Hello, everyone. Again, this is for the pharmacy people out there. Like, again, newly minted licensed pharmacist here, which is weird. But like I said, going with my MPGE video, I always said that I was gonna make another video. I would always make a video and see if I can impart some advice to people that are nerve wrackers. And then this one's gonna be the Naplex. Now, the Naplex you need to pass. Like, the Naplex it's important, but I'll find that a lot of people overstudy for it. It's not that bad of an exam. I'm going to tell you that right now. Like, at least for me. But it is, you do remember, you don't want to fail it more than five times or three times. Because this is an exam that you need to pass. Like, this is like a universal exam. You need to pass this. Like, unlike the MPGE, where like, okay, I failed all the times I can do in a state. I felt all the times I can like in a certain state, you can always go to another state. Oh, okay, like for me, for example, it's like, I failed three times, I failed five times in Colorado. Shit, I'm screwed. Oh wait, I'll just go to Nevada. I'll just go to California and take that drug and be licensed there. It's different. It's different. Like MPG, you can afford to fail because they have other states to work with. The Naplex, not so much, because the Naplex, like I said, it's a universal exam. It applies to every state. You need to pass this regardless, and you only get five chances to pass it. Then you had to go to like a board of pharmacy or something, some crazy stuff, or remedial education, and not just that, but even some states you can only fill it three times. Like my state, it's three times. Then you have to do remedial education. Like, and so you don't want to take this too lightly. And so a good resource to use is RX Prep. And yes, this is the old edition of RX Prep. I know they came up with the 2019 version, and I think it's all in color, but this is what I use. This is really only the only thing you need to have to pass that exam, in my opinion. Like, you don't need much, but this RX Prep is fantastic. It has everything you could ask for. It has up to date guidelines. In fact, it's too detailed, in my opinion. It's way too detailed. There's certain things you're not going to need to know, but this is what I used to study, and it did the job. In addition to that, I also bought the RX Prep questions, or exams and question sets online. That's also another thing that I recommend getting to. But when you buy those RX Prep exams and questions online, I just wanted to caution everyone, those exams and those quizzes on there are a lot harder than what you will see on the Naplex. Like, so don't freak out if you're getting like a 60, 70s or 80s, or you're not exactly knocking those out of the park, because those are a lot harder for sure than you'll see on the actual Naplex. So don't freak out. I'm telling you that right now. And so what I did is I actually, honestly, I started studying for the Naplex during my P4 rotations. Like, and in fact, I would recommend everybody do that. Not just, and when I say that, I don't mean I wasn't hardcore studying like, oh my god, I'm like 5 hours a day, but I was like, kind of leisurely studying. You would say, maybe reading a chapter here, there, taking notes and stuff like that. So I was studying when I was at P4, and when I was at P4 for it. But the biggest advantage is of studying when you're a P4 and reading a few chapters of this book, is that it'll not only will it help you on your Naplex, it will drastically help you on your rotations. I swear it will. Like, cause when I got to my medicine rotation, which was my mod 4, you know, which was my mod 4 or 5. I can't remember. Like, cause I had an ambulatory rotation in mod 3, but when I got to my medicine rotation, like I had pretty much gotten through most of the book already, and so when I came in there, like I impressed my preceptor because everything was fresh in my head. Everything in this book that I was reading applied to the medicine rotation. It was fresh in my head. I knew it. And so my preceptor was incredibly impressed with me. Oh, he was incredibly impressed with my partner too, because we both knew our crap. But I knew my crap because I was looking at this book. And so, like I said, it's a good idea to give this a read when you're on your rotations too, because it will drastically help you. And you can impress your preceptor, I can tell you that much. But yeah, and so I really didn't start studying, seriously studying for it until a few weeks after graduation. Like, I would say about 2 or 3 weeks after graduation, because after graduation, take time for yourself. Take a little time for yourself. You graduate, it's a huge accomplishment. Go on vacation, relax, lounge around, hang out with friends while they're still here, because a lot of my friends are gone. They left the state, they're in California, they're in like Florida, like California, Florida, New Mexico, Michigan, which they're all over. So, you're gonna have to do the goodbye tour and stuff like that too. But take time for yourself and then really start studying. Like, look over the stuff, highlight, reread, and also do the RX. Like, I use the RX Prep, and the reason I use the RX Prep quizzes online was because when I was reading this book, I felt that I wasn't getting as much as I wanted to out of it because I wasn't really applying the questions very well. I felt that okay, I have this knowledge, but I have nothing to apply it to. I don't have a scenario to apply it to. I don't have any questions to apply it to. I don't have anything to apply it to. And so the RX Prep really, the question sets online, they really helped me apply the knowledge, you know, kind of similar to how to Naplex. You're gonna need to apply knowledge, and it really helped apply the knowledge that I had from school and from the book. And so yeah, so pretty much I would say if you did what I did, you probably could get away with it with studying for like a month of intense studying. If you didn't study throughout rotations, then I probably would say about six to 8 weeks of studying should get you ready for the Naplex. Like advice, take it seriously. Oh, yeah, take it seriously. Don't freak out because remember, you went through 4 years of school for this. So you have that foundation is there. That knowledge is there, the foundation is there. You just need to reinforce it by reading this book and building that wall up, building a nice wall up. So don't freak out. Remember, you went to 4 years of school for this. It's there. The knowledge is there. So that's another thing. Yeah, and yeah, I don't think there's much else. Like, just if you put this is an exam that's very objective. Like, it's very objective. Unlike MPGE, it's very objective. The MPGE is very subjective. Like, if you were to ask 100 pharmacists the answer to a certain question on an Naplex, 95 of those pharmacists will give you the same answer. Whereas in the MPGE, if you do the same thing and ask 100 pharmacists about a question on the MPGE, it'll be all over the place. You'll get like 20 pharmacists will pick this, 40 pharmacists will pick that, 35 pharmacists will pick this question. Like, it'll be really spread out. So this jam it's very objective. You're not going to get trick questions. You're not going to get questions out of left field. They're going to be like, I never heard of this. What the hell is this crap? This is insane. You're not going to get any of those type of questions. You're going to get questions that are very fair, that will test what you learned in school, not some crazy ass scenario like the MPGE. So just remember that. And so my advice to you, my also last parting wisdom, know how to do your calculations. That's a huge thing. And those are really huge points that can be your best friend or it can be your enemy. You know what I mean? Those are points that are probably worth more than other questions. Know how to do your math. Know biostatistics. And trust me when I say this, biostatistics are easy, especially on the exam. It's pretty easy. You know what I mean? If you do RX prep quizzes online, you're not gonna have a problem. Same thing with the math questions. If you could do those successfully on the RX prep quizzes online, you'll be fine on Naplex. So know your math, know your biostatistics, know the major disease states, know ID, like, and for those of you who don't know, infectious diseases, know that true and true. Not just that, know the drugs, know that true and true. Know the drugs, know the bugs, like the bugs, know what's needed to treat, what you would use to treat those bugs, know disease states, what you would use to treat those disease states. Know what can happen with these medications. What are the side effects? What labs can they affect? Know No contraindications to these medications. No first-line therapy, second-line therapies, third-line therapies. Know that. Like, oh crap, I can't give a tetracycline to a kid. What would be an alternative therapy? Stop. Like, know that for ID. So know that chapter really well. Know your cardiovascular chapters. And when I say cardiovascular, I mean hypertension, cholesterol, stroke, and stroke. And then the other thing I would say, anticoagulation chapters. Know that for sure. As a pharmacist, you need to know that 100%. That's like a pharmacist's bread and butter, or is anticoagulation and dosing it. Know that chapter like the back of your hand. Know dosing, dosage, all of it. Know everything you could possibly know about anticoagulation. Not just for the Naplex, but for your future, for your future as a pharmacist. You're gonna need to know that. That's important. So know that. And then, like I said, no diabetes, no, like the major diseases, diabetes. I'm probably missing something. HIV. When I say HIV, like no, like maybe mechanism of action, brand name, and generic names. You know what I mean? Know that. Know like the baseline oncology stuff too. And then, but yeah, those are the main chapters, like ID, anticoagulation, cardiovascular stuff, diabetes, oncology, HIV, mass. Oh, and no compounding. No, like the compounding stuff, like what's diluent, what's lubricant, what are you going to use for this? Know that too. And so that's pretty much it. And so for the other chapters, like, I don't know, OTC, lice, pimples, whatever, have a baseline understanding of those. You don't need to go too deep into those chapters, just have a baseline knowledge of it. You know what I mean? Whereas like these other chapters I mentioned, like ID, math, biostats, cardiovascular, anticoagulation, compounding, diabetes, know that really well. And that's my advice. Now, this is like I said, this is an exam that if you put in the work, if you put in the effort, if you study your ass off, you're gonna be fine. Whereas you cannot say that for the MPGE. If you study your ass off, it's gonna be a toss up. But this is an exam. You put in the work, you're gonna get the results. Thank you very much for watching.